Hi everyone, this is Jaran from Height Reduction team. Today we're going to answer your most asked questions. Firstly, one of the most asked questions is, how many height reduction surgeries have been performed so far? Our last patient had this surgery this week. The reason why there are so few surgeries is that height reduction surgery is practically a new approach, and that in the world we are the only ones that have performed this surgery. The second question is, what is the recommended amount that can be reduced with the surgery? Firstly, the recommended amount to be reduced on femurs is 5.5 centimeters, as we have stated before. And the amount that can be reduced on tibia is 3 centimeters. However, we haven't performed any tibia surgeries yet, as it is possible to reduce more on femur and our patients like to choose it for the first time. As you can also see here, the maximum amount that we have reduced so far is actually 6 centimeters. But this is not the usual for everyone, because we need to prevent the muscle imbalance with the surgery. And reducing more than the healthiest amount can lead many health risks as well. Other than the 6 centimeter that we have reduced, we have 5 centimeters, 4.1, 4.8, 5, and 4.9 centimeters. Another question that we receive is mostly about the post-operation part, which is, am I going to be able to walk like normal? The answer is yes. As long as we reduce the maximum amount that does not reach your limits and is the safe amount for you, you will not have any problems with walking. But it is very important to keep in mind that this is a surgery, and after that, for a few weeks, you need assistance. And even if you leave walking with the assistance, you might start walking a bit weirdly. This is mostly about receiving the adequate amount of physiotherapy, exercising, and practicing how to walk like normal. But yes, to sum it up, it is possible to walk like you used to. Another question that we receive mostly is about the postoperative process. So after the surgery, you will have 3 days of hospitalization, during which our doctor, nurses, and physiotherapists will be visiting you daily. You will also receive 2 sessions of physiotherapy during this process. And after those 3 days, you will be transferred to one of our accommodation options, if you choose to stay with us, which we definitely recommend. When your hospitalization process ends, you will need to walk with an assistance for 6 weeks in total. During those 6 weeks, we will be consulting our doctor and physiotherapist about every single stage of your progress. With the x-rays that we receive and provide for you, you will need to switch to crutches first from walking with the walker, and then you will start walking without any assistance after 6 weeks. But of course, it will be very healthy to keep in mind that this is a huge surgery, and after that, even if you start walking without any assistance, it is completely normal to not walk as if you never had the surgery. As all of you say, it is very normal to walk a bit funny or weird. But as you keep up the physiotherapy, exercises, and practice your walking, your gait will turn back to normal, and then you will start going back to gym, exercise, and even do heavy training once your full bone consolidation happens. The full bone consolidation, which we call the full and complete recovery, happens in 3 months. Thank you for watching and listening to us. In order to receive more information about this process, don't forget to follow us on our YouTube channel, Instagram account, and also keep up the good work of sending us questions about the whole procedure. Wishing you healthy days ahead.